Hello, everyone. Good morning. Good morning. Good morning. Good morning. Welcome to day 38 of Van Health daily updates for the COVID 19 pandemic. So, during the COVID 19 pandemic. Welcome to our updates. Hope you're all doing well. Yeah, I am hanging in there. Sometimes I'm like, oh, God, it's just, another day, another sort of data that is coming in again. But then we encourage ourselves, we do our meditation, we do our prayer, do whatever else you need to do, your exercise, and just get your encouragement back on again. So it's day 38, and the whole point of the updates is to, bring you facts from the previous 24 hours and give you tips on how to survive and to thrive during this period. This time, today, I'm just going to deal with some questions and answer questions that I have missed in the past. I mean, I've responded to these people individually as well, but I will just put the answers in. I'll talk about the questions today and just share those with you. I think that's all I'll do today. So I'll just give you the update, do the questions, and then sort of call it a day there. So what's happened in the last 24 hours? I felt a little bit discouraged, but again, I've encouraged myself. I felt a little bit discouraged when I looked at the data from yesterday, because before yesterday, we had the number of deaths falling in the UK, that is, from 596 went down to 449, and then, but unfortunately, yesterday it went up again to 823. But then again, it's, these things will fluctuate and hopefully would settle. But the number of admissions in London is falling, so that's a good thing. So even though we feel a little bit disappointed by that outcome, the general picture is that things are still better. So that's happened in the UK. There's still the whole debate about PPE that hasn't gone down. People are still talking about it, and I actually think that some doctors and nurses now are just fed up, of continually talking about PPE, and we're just doing the best we can with what we have. And many people are getting their own supplies, which is a bit disappointing, really, that people are feeling that way. I think the debate comes where some of the managers or some people in the higher office think that some of the flimsy equipment are good enough. And, if you're going to go and see somebody who possibly has coronavirus, you want to protect yourself. It's not just about yourself, it's about your families as well. So that divide is causing a bit of tension, and people have just stopped really talking, and we just do what we can. So that's what's going on in the UK. And the US is interesting because, again, the cases have gone up to over 45,000. Really, really shocking, really disappointing. But more than 45,000, Trump is just getting very upset about different things. And as I said yesterday, shut down the borders and decided that there should be no immigration for the next 60 days. And the reason that he has given is that he doesn't want competition for the jobs in the US. Well, he's a president, so I guess he can make those decisions. So those of you that want to emigrate to the US, that's not going to happen. No processes, everything is shut down for the next 2 months. I guess after 2 months, we'll see and we'll reevaluate what happens. The vaccines, again, as I said yesterday, vaccines are getting closer and closer. We're excited. Oxford University is trialing them from this week, I think. So we're very close to getting a vaccine, but the vaccine process takes a long time. So we'll keep our fingers crossed. It's quite demoralizing. It's very demoralizing because it's just I don't know what the problem is with PPE and the fact that we should have more than enough of this. It should be flowing. Nobody should be having to reuse masks. Nobody should be having, because they're even saying to people we might have to start reusing equipment if this scarcity continues. Although I know that there's a plane coming from Turkey that landed today that is bringing a whole truckload of PPE. I don't know if that's the same for other countries around here. But yeah, I think the best thing is if you know anybody doing PPE, like all the schools, some people are giving it away, just beg for some, because some of our practices we're actually begging people to give us PPE, and we've had some donations. It's just the way it is. Just to talk about Nigeria, the update from Nigeria, the cases are going up in Nigeria. That is really a bit disappointing. I was saying that I'm hoping that it won't double, from 493, that it won't double. It was 493 on Saturday gone by, and that it shouldn't double by next Saturday. But actually, I think it's already 782 cases now. So it's really climbing, and then 25 deaths. So it has to be contained, otherwise it's just not going to be good. But people are still hungry. Now, for those of you who are middle class in Nigeria and who are able to stay home, as I always say, no offense meant, with security, and you're safe, be grateful. But the majority of people are hungry. They're insecure. There's no security. Really scary. So, we'll just all keep trying. The pandemic affects everyone, so not just Nigeria. I think that's basically all the updates. Germany is still doing great. As I said yesterday, they've reopened little shops. Even Spain, despite the fact that there are over 20,000 deaths in Spain, they've reopened some of their shops and trying to get their economy going again. People are just ready to get back to that sort of semblance of normal. And I suspect in a few weeks, that will be the same thing in the UK. A little bit of, things will start to open up, and then we'll have to start to protect ourselves. So there are two questions that I have to discuss today. One of them is very, very funny. The question goes like this. Please, what's your opinion on when someone beats COVID-19 and tests negative? Does he walk the streets bare-chested like the Hulk, or is thankful and hides in a corner again? Is it like chickenpox or flu that doesn't hit the infected back-to-back post-recovery? Please share your thoughts. I think I've discussed this before in another broadcast. The jury is still out, but if we go by our medical training, a virus should not be able to reinfect the person a second time. So, but the thing about viruses is that they mutate. That means they change their form very, very quickly. So they will, they're like chameleons. So the coronavirus, once you've had that, ideally you shouldn't be able to get that same strain. Again, you should be immune, but there's still evidence going on because this is a new virus, and most of the scientists are quite surprised by the way it's behaving. So we don't know. Essentially, the answer is we don't know. But based on how other viruses behave, you shouldn't have coronavirus again when you've been infected before. But there have been different cases from different areas saying that it can happen again. But again, if it changes a little bit, it can then reinfect the person again. So, but the jury is out. The answer is we don't know if that can happen with this novel, this sort of SARS-CoV-2, whether that can happen again. But if you've had it before, you have a sense, some sort of protection, because you shouldn't be able to ideally get the same one again, based on our science, based on our medical knowledge. So that's that question. I hope that answers that clearly. The other question I had was about the dose of vitamin D to take. I think maybe I've not been really, really clear on vitamin D dosage. There is the treatment dose and there is the maintenance dose. So if you are vitamin D deficient and you've been lucky to have a test, which you don't generally tend to get, particularly in the UK, but if you're lucky to get a test and your levels are low, you can have it tested privately. So you can have a private test for it if you want to know. If your levels are low, then you have to have a treatment dose for 7 weeks, which is usually about 20 to 25,000 units once a week for 7 weeks. Now, if you are not deficient, but you just want to make sure that your vitamin D levels are fine, for darker skin, I generally tend to recommend between sort of 1 to 4,000, 5,000 units daily. Personally, I make sure I take 5,000 units a week, and I'm good with that, 5,000 units a week. And I always say that with children, sort of, young children, 1,000 units a day is absolutely fine for them. Black children, that is, yeah. But you can also decide to take it twice a week. You can decide that you want to take 3,000 units twice a week, and that's it, or 3,000 units 3 times a week. You don't really generally want to go above 10,000 units a week. You want to make sure that you don't get vitamin D toxicity, because if it's too much, then there's a problem with that as well. So the dose is flexible. For many shops, they only sell the 400 units vitamin D. Really wouldn't help most black people. You need higher doses, starting from about 1,000 units, I would say, taking a minimum of sort of 1 a day, and they're just ongoing. but just titrate it depending on the dose that you have, and use it. But definitely take your vitamin D. It's very, very crucial. So that's really all I'm going to share with you today. I think short but sharp. Hopefully you find it helpful. We'll carry on discussing all of this. Before today, I think I might tackle the issue of maybe diabetes tomorrow, or again, because I really want to start talking about these chronic diseases and talking about how to reverse some of these things. Doesn't mean that you cure it, but you can be in a state of remission, you know, where your levels, like what they call HbA1c, is normal. So I think let's start really dealing with some of these chronic diseases and how we can go back to normal with those. Anyway, guys, have a great day. Watch the video, share it, like the page, distribute it. Just let's get the word out. Let's just share health to everyone. Health is wealth. Without health, you can have nothing else. And surround yourself with positive news today. Take care. Bye.